This is a presentation of PEAK Program Module 14N by Danielle Jordan, Robert Moore, and Allison Grunlow. The PEAK Direct Training module teaches basic language skills. It uses programs that promote correct responding contingent on feedback. Included in the PEAK program is a comprehensive assessment of the learner's current language skills. After a direct assessment by the parent of two of the participants and an indirect assessment by a parent of the third participant, it was determined which skills the learners already had in their repertoire. We chose 14N as the program to run. 14N uses direct training to teach the verbal operant of tacting. According to Carolyn Hesse, 1987, page 55, the tact is a verbal response whose form is controlled by a non-verbal discriminative stimulus. This can be an object or event or a property of an object or event. This chosen module more specifically uses metonymical tacting. Metonymical extensions are verbal responses to novel stimuli that share none of the relevant features of the original stimulus configuration, but some irrelevant but related feature has acquired stimulus control. From Cooper, page 537. This program uses discrete trial training. Quote, discrete trial training is primarily based on tact and receptive training with nonverbal and verbal stimuli and delivering nonspecific reinforcement. End quote, Sundberg and Michael, 2001. Page 719. This helped to ensure that each presentation of stimuli received the necessary feedback so each correct response could be reinforced immediately and each incorrect response could be corrected immediately. This project is needed to show that any learner can identify stimuli by an uncommon name. A child may be able to identify a picture of a bed when hearing bed spoken by another person, tact a bed, and even man for a bed, but may not have tendency to say bed when hearing someone say sleep, or more formally when hearing you sleep in a, end quote, Sundberg and Michael, 2001, page 713. Mastery of Module 14N will promote a language that is generalized and flexible, thus also promoting better social skills of the learners in all environments. We were able to show our learners were trained in metonymical tacting, equipping them with skills to have a better developed verbal repertoire. Our participants included 3 females. Participant A was age 4.5, a twin with average development. Participant B was age 4.5, the other twin of participant A, and average development. Participant C was age 6, also with average development. All participants live at home with both parents and no other. For participants A and B, the setting was their playroom at their house. The room included various items including chest, play kitchen, bookshelves, toys, and stuffed animals. The room was clean and all toys and debris were put away during the trials. This room was chosen because it was the most comfortable for the participants. The 2 instructors would take each participant at one time into the room to do a trial. For participant C, the setting was at home on the home of the individual sitting at the kitchen table with no distractions. 10 pictures of objects were printed from the computer and cut into 2 inches by 2 inches. The 10 pictures were the 10 stimuli presented throughout each trial. Stimulus 1 was a $5 bill, Stimulus 2 was a lamp, Stimulus 3 was a horse, Stimulus 4 was a triangle, Stimulus 5 was a tornado, Stimulus 6 was an airplane, Stimulus 7 was a trolley, Stimulus 8 was a cloud, Stimulus 9 was a present, and Stimulus 10 was a car. PEAK Program 14N was performed with each participant individually. 10 blocks of trials were completed each day for 10 days, and each trial consisted of 10 questions. A baseline of 1 trial was performed for each participant. Each participant was brought into the room and sat on the floor for the procedure. It was explained to each participant that they would be given instructions or asked questions and to just do the best that they could. Participants were presented with a field of 5 pictures, 4 chosen randomly and 1 picked as the answer. They were then asked to show me the or give me the. If the participant gave the correct answer, they received a score of 10. If the participant gave the incorrect answer, they were prompted with a least to most prompting procedure until the right answer was given. Scores of 0, 2, 4, or 8 were given depending on the prompting. Mastery of a trial was considered 3 consecutive block trials at 90% correct. Inter-observer agreement was completed on 20% of the blocks of trials by 2 trained observers. These 2 trained observers had explained to them what was going on and what to look for. They used event recording with a pen and a paper. Total count IOA was calculated, and IOA was 100%. The results for participant A, she reached her baseline at 20% after 1 trial, and then the rest of the 10 trials continued to improve. Participant B's baseline was 0% after 1 trial, and the rest of the 10 improved. Participant C's baseline was 40% and improved over the next 10 trials, and participant C mastered the program at block 10 after having 3 consecutive 90+ percentages. Over the course of the program, participants A and C progressed daily and demonstrated learning the skill, and participant C mastered the skill. Although participant B had minor dips in the data, she also demonstrated learning the skill. Throughout this program, each participant gradually increased their ability to correctly identify the object being asked for. Throughout this program, each participant was gradually taught the correct response, and in later block trials proved that they were learning by consistently answering correctly. Therefore, the participant was gradually learning metonymical tacting. In accordance with current literature, these findings support that discrete training of metonymical tacting is important and effective. Some implications for practice research include: this program was developed as an evidence-based autism assessment and treatment. Although we did not use children with autism, it has become clear that this program may also be used in children who are average in their development to help increase skills they have already acquired and improve on them. Further research could also be done on using PEAK on comparing the verbal repertoire of twins. Our data showed that the twins performed differently during the trials, with one being slightly under the other as far as percentages went. Excuse me. Some limitations of the study were that the children were of different ages. The setting for the twin girls could have been too distracting, possibly resulting in lower scores for one of the participants. Multiple people should do an assessment for one child, but we only had one person do an assessment for a child due to the availability and living. Excuse me. This is a graph of our data collected, showing each participant and their scores over the baseline and block of 10 trials. These are also our references that were referenced earlier in the introduction slides. This is our program. Thank you for listening.